You're such a positive bunch. It's fantastic. Bienvenue ici au Manitoba. Thanks for being here in Manitoba. Anybody wants to relocate and stay here, we're happy to have you. We need at least 1,000 more nurses, don't we, Sandy, as people retire? So it is true, you know, we've had a fantastic relationship with the nurses, and I see Vera Chernecki over here when she was president, and Maureen Hancherek, and now Sandy Mowat, and all of the leadership in the Manitoba Nurses Union. They've been tough, but they've been great to work with because we actually do share the same objective, providing the best health care we can for Manitobans. And I know that in this collective bargaining process, I can remember Dave Chomiak showing up at my house at 4 o'clock in the morning. If we could just do this, we can have a collective agreement. And of course, when somebody shows up at your house at 4 in the morning, how can you disagree with them? And we settled many good collective agreements. And even in this recession, I want to thank the union. We worked out a collective agreement that put a real priority not only on maintaining employment, but improving pensions for nurses. And that was such an enormous accomplishment to strengthen that pension plan. Because when you give a life of public service, what is the most important thing after that life of public service? A reliable, stable, decent pension plan that allows you to live in dignity after you've finished your years of service. Yes, and we support that in all the public sector in Manitoba, but the nurses have led the way on getting benefits for working people. And so I want to commend Sandy Mowat for all the work you've done, and I want to continue to hope that you have great success in being elected, and we will be around to work with you in the future. We said it in the 90s that we saw 1,000 nurses get laid off, and some of you may remember that. And as Sandy said, we've replaced every nurse laid off and fired with 3 people hired in the last decade. So it's 3 to 1. 3,000 more nurses in Manitoba now that weren't working here before. And it has made an enormous difference on the front line. We never used to have any nurse practitioners in Manitoba. We have 100 plus nurse practitioners in Manitoba. And we're now saying that one of the ways we can improve healthcare delivery is this concept we've called quick care clinics. We're going to have clinics set up, personed by nurse practitioners and nurses and other health professionals, and they're going to be in shopping malls and places where people go, where people can have quick access, get a diagnosis, get their issue addressed, and move on. So we want to improve healthcare at the front end of the healthcare system to provide as much support to our citizens as possible. And of course, we want nurses in rural and northern Manitoba too, so we've got incentives to do that and training programs all over the province that will allow nurses to get, if they're in the north, they can train in the north. They're in rural Manitoba, they can train in rural Manitoba and then stay and work there. And of course, we have a recruitment incentive. So like I said, I'm not trying to poach, Linda, I promise. But if anybody wants to come to Manitoba, got a good hockey team now, got a good football team, we'd be happy to have you. There's no two ways about it. And one of the other things that Sandy's worked on, and we're committed to following through on, is safety in the workplace, less violence against people that are working in the healthcare system. So, with the leadership of the Manitoba Nurses Union, we have committed through our Minister of Labour to work with the Nurses Union to have a regulation for nurses in the workplace, a regulation tailored specifically to the healthcare workplace that will reduce violence and have very clear rules on how we do that and very good prevention measures, because we want the workplace to be a safe workplace, a place where people can work in dignity. And we know that some of the challenges that nurses face on the front lines can be extremely difficult. I'm not in any way blaming the patients. They come in with some very challenging circumstances. But anything we can do to make the workplace safer will be good for the community, it'll be good for patients, and it'll be good for people that work there, nurses. So we're committed to following through on that. And I hope we can come up with a model regulation that can be used all across the country. I hope we can set a benchmark here that you folks can benefit from wherever you are in the country on how we can have a safe workplace. We will work towards that objective with you as we go forward. That's our commitment. And last but not least, we did a program in Manitoba with the Canadian Federation of Nurses Unions and the federal government on how to train people to work in the long-term care settings. And that training program and mentorship program has gone extremely well in Manitoba. So today I announce we will make that program permanent in Manitoba. We will have a permanent program. We will have a permanent program so that people can get all the support and training they need to work in the long-term care setting, which is an enormous part of what our future investments are. We've committed to extending long-term care facilities in Manitoba. Vera, as past president, sits on the board of a very prominent nursing home in Winnipeg, the Holy Family Nursing Home, and for some reason we just went out and announced a big expansion and rebuild of that, and we're doing that all across the province. We believe that we have to have care settings, not only nursing homes, assisted living and supported living, and home care, but we need to provide supports to people to live as independently as long as possible. And how are we going to do that? We're going to have nurses on the front line that can work with people. Nurses in the community, nurses in our institutions, nurses in our personal care homes, and now nurses in places like quick care clinics. So I want to again thank you for coming here to Manitoba. Merci pour votre présence ici au Manitoba. Have a good time. I know you've been having a heck of a good time. If you want to come down to the legislature and go into the galleries and heckle the opposition today, we'd be happy if you wanted to do that. That'd be great. And I hope you have a great stay and here in friendly Manitoba. And thank you for the opportunity to address you today. We look forward to many productive years ahead working with you and your national president, Linda Silas from New Brunswick. She's got that pep that's going to make a difference for you, and we'll be working with you every step of the way. Merci beaucoup.